Hello, my name is ageeslin. I'm an Aspen University student enrolled in Dr. Tammy's Community Health Nursing course, and today I'm presenting an overview of my Infection Prevention and Control Community Education project. The objectives for this presentation are listed below. Today I'm providing a summary, evaluation, and conclusion of my community education project on infection prevention and control. Part 1. Summary. Assessment completion. When determining what my project would be, I asked myself, what am I passionate about and what will allow me to meet all course objectives? I knew I was passionate about kids and helping underserved communities. My mom works for the Head Start program and is often telling me about the issues she sees families frequently facing, especially pertaining to health. Collaborating with the director and health manager, I learned more about these issues in my targeted audience. I was provided data and educated on the long-term issues of kids missing school due to illness. My targeted audience. My targeted audience involved low-income families with young children enrolled in the Head Start program. The Head Start program offers so many services and resources to children and their families to help financially, developmentally, medically, and mentally. I wanted to make sure that the children are healthy and stay in the classrooms as much as possible to ensure they receive all the benefits the classrooms have to offer. My face-to-face presentation was performed in front of 5 Head Start program staff. My educational packets and video presentation were sent to 238 families. My chosen topic. While collaborating with the Head Start staff, I learned that there are way too many ill kids attending school. These kids must be sent home as soon as staff take note of various symptoms. In the meantime, they are infecting other students, causing them to also miss school. Kids and their families miss out on the many benefits the program has to offer when their kids are absent. Staff were concerned that families were unaware of when they should be keeping their kids home with particular symptoms and when they should be safe to return to school without being contagious to other kids and staff. I realized that these families needed education on infection prevention and control, specifically to childhood illnesses. Topic justification. Head Start offers many benefits for children and their families. When kids miss school, they are missing out on many opportunities the program has to offer. Many kids rely on the classrooms for structure, a safe environment, daily nutrition, child care, and socialization. Educating families on when they should not send their kids to school and when it is safe for them to return will cut down tremendously on the spread of infection and keep kids in the classroom. My project presentation. An educational packet was sent home with each kid to be given to their parents on April 4, 2022. The packet included an infographic with summarized infection prevention control education information and an overview of what germs are, fun handouts and flyers to be posted around the homes as reminders to wash hands and to sneeze, cough into their sleep or into a tissue, a quiz and a survey for parents to complete and return to school with child. I also presented an in-person presentation for the Head Start staff in one of their unused classrooms, acting as if they had the same demographics as my targeted audience. The video was recorded and sent via email to families in the monthly newsletter. Obtaining permission. I set up a meeting to meet with the director and the health manager of the Head Start program. They granted me permission to conduct my project, and we discussed what I was and was not allowed to do. I cannot directly provide information to families or students due to COVID-19 and privacy concerns. However, together we conducted a plan to educate the families without direct contact. We decided to send information home with the kids and to email my full presentation to them with a monthly newsletter. Advertising my presentation. The in-person portion of my project was advertised throughout the building to staff via email. The director sent an invitation email containing a summary of my project and the date and time that I was presenting. All interested staff were welcome to participate. Unfortunately, there was not much advertisement of my project for the families. The day that the kids were sent home with the family package, the director sent out an email to all parents informing them of what would be placed in their child's backpacks, and encouraged them to participate for a chance to be placed in a drawing for a $25 gift card. The gift card was an attempt to catch more families' attention so they could receive the information. Packets were placed in the kids' backpacks to take home in hopes their families would read the email or check their child's book bag to notice the provided packet. Educational materials. The family packets included an infographic with summarized information, flyers and handouts that were fun and colorful to help increase interest and enhance understanding of information. A quiz was given to assess whether they learned the material, and a survey was also given so they could give feedback on the information provided. My in-person presentation was in-depth PowerPoint presentation and was recorded. A hands-on activity was conducted using glitter. Staff first passed around a pen covered in glitter, then a clean ball was passed around to show how easily germs can transfer from hands to other objects. Part 2. Project Evaluation. Evaluating the effectiveness of education provided. To evaluate short-term effectiveness, I provided families with a quiz and survey to complete. I used the quizzes to assess whether they truly understood the material. I provided a short survey asking families various questions, including whether they thought the information was helpful, if it was presented in a way they could understand, and if they would use it as a future resource when their child or family member becomes ill. To evaluate longer-term, more accurate results, I could collaborate with the health manager. She inputs all health information into a database. She inputs when children must be sent home and what symptoms they experienced. She also documents when children miss school and tries to obtain information on their illness. And even when possible, she inputs data about household illnesses and diseases of other family members. We could compare the data prior to my educational project being presented and the data obtained after my presentation to evaluate whether less kids were having to be sent home ill and if there were less absences in the classrooms. Response from families. Only 36% of families returned the quiz and survey. Quiz scores were nearly 100%, if not perfect scores. Each survey had positive feedback on finding information understandable and perceived it as being a beneficial resource for the future when kids or other household members become ill. Satisfactory and unsatisfactory aspects of my project. The unsatisfactory aspects. I knew going into this project that it would be hard to get my targeted audience's attention to become interested in the learning materials due to limitations of the project. I wish I could have gathered the families to present to them directly. I think that if they could have seen my compassion, personal relatability to the project, and my non-judgmental demeanor, that I could have reached them better and gained better respect for healthcare employees. I did not receive feedback from as many families as I would have liked. I'm unsure if they just tossed the packets in the trash or if they actually reviewed them and just didn't take the time to complete the quiz or survey. The satisfactory points. I believe my project was essential for families to learn to keep themselves and others free from preventable infections. I have high hopes that those who did review the materials and watch my presentation will use what was taught to them for the future within their homes. Despite the limitations, the project planning and implementation was a smooth process. I myself learned many things to use within my own family. Things I believe went well. Collaboration with Head Start staff was great. They were more than willing to help me coordinate my project. The director and health manager provided me with education and insight of low-income families with young children. Classroom staff assisted in providing packets to families and obtaining the surveys and quizzes that were returned. The feedback that I did receive from families was all positive, and families reported that they found the information beneficial to be used in their future. Implementation of providing family packets in my in-person presentation all went as planned. There were no technology or scheduling interferences throughout the process. Changes that could be made in the future. I would have tried to reach my targeted audience sooner to gain more of a rapport with them. I would have introduced myself and my project early on and really put emphasis on my passion and reasoning for conducting my project. I would have assessed the family's knowledge on childhood illnesses and infection prevention and control early on to determine what they know and what they really needed education on. Part 3. Conclusion and Reflection. My newfound perspective on my community's health. Prior to researching my targeted audience, it was easy to just think, how on earth could parents send their kids to school when they're sick? Now knowing a little more about their demographics, I realized that if they were never educated on germs and infection control and prevention, how could they have known when to keep their kids home or how easily germs can spread? My targeted audience is an extremely vulnerable population that is underserved. We should not be biased or judgmental. We should be doing everything we can to educate and gain their respect for healthcare professionals. My newfound perspective on local, state, and national level efforts to promote health. As a nurse, viewing the CDC, Department of Health, and other organizations that try to keep their healthcare systems and communities healthy, I thought they were very extensive and over the top with the policies and procedures they put in place. As a now educated community member with insight on public and community health, I have the utmost respect for those organizations. The impact on my targeted audience. I hope that my project had a positive impact on my targeted audience. I believe that they will be more mindful when their children become ill to make better decisions. They may not fully understand everything that was taught, but they now have the resources to help guide them to make the best choices. I like to believe that my non-biased, nurturing demeanor may have helped them gain more respect and/or trust for healthcare professionals. Thank you for your time and interest in my community education project on infection prevention and control.